It's my pleasure to introduce this bill today, which we're calling the Menstrual Products Access and Equity Act, to reflect the spirit of the more than 150 pieces of legislation across the country at all levels of government that are working to address a really important issue, the blight of period poverty. I'll talk more about that in a second. Simply put, menstrual hygiene and health is a public health issue. Across the world, period poverty or lack of access to over-the-counter products to manage menstrual bleeding isolates people who menstruate. In the United States, access to products is severely limited in public spaces. I'm grateful to the leadership of women and many others who are strong advocates for menstrual health. This legislation is particularly meaningful to me and to our office because one of our summer interns, 2023 interns, Lulu August, brought the idea forward and helped me and my team in the early stages of development. The background work on this bill, including its initial drafting, revision, research, meetings, and more, has been done by women in my office, on council staff, and in government and community entities. In the words of Jennifer Weiss-Wolf, who popularized the term menstrual equity, I quote, "In order to have a fully equitable and participatory society, we must have laws and policies that ensure menstrual products are safe and affordable for everyone who needs them. The ability to access these items affects a person's freedom to work, study, stay healthy, and engage in the world with basic dignity. And if anyone's access is compromised, whether by poverty or stigma or lack of education and resources, it is our societal interest to ensure that those needs are met," end quote. Today, anyone who uses a public restroom expects to find basic supplies needed to be healthy: clean running water, a functioning toilet, toilet paper, and soap. Menstrual supplies are a part of basic health for more than 26% of the world's population who menstruate every month, and more than half of our population who has or will menstruate in their lifetime. To overlook menstrual health needs in the U.S., and particularly here in Montgomery County, impacts residents and perpetuates a stigma on this important issue. I have and will consistently advocate to lift barriers that impact individuals, families, and communities from thriving and meeting their full potential. Some may ask, why should we expect menstrual products in public bathrooms? It's a good question. As I mentioned earlier, the term period poverty includes lack of access to the over-the-counter products to manage menstrual bleeding, and it affects, again, more than a third of the world's population. It impacts Montgomery County residents of all backgrounds as well. Menstrual inequity, and stigma can impact individuals' physical and mental health, their education, their work, and their ability to participate freely in society. As a husband to an amazing wife and to 3 incredible daughters, I want them to have, along with everyone, to live in a society and a world where they are free from shame and stigma and have what they need to be healthy and happy. Bill 4223 and its accompanying health regulation would require that certain public accommodations that have publicly accessible bathrooms have menstrual products available at no cost. This includes county public buildings, along with establishments that are required by law to have a public bathroom, like restaurants and conference centers. My team has met with public, private, and nonprofit partners and has listened to their feedback and will continue to do so. This bill provides flexibility for establishments to support public health in a way that works best for them. For example, the Greater DC Diaper Bank, who is supportive of this legislation, collects menstrual products and gives them out to members of the public. Some of these businesses could be beneficiaries of some of these donations. I want to note for the public and the millions watching at home that our county code, section 2710, lists several types of public accommodations. Bill 4223 only requires menstrual products in public accommodations that were required by law to have a bathroom available to the general public and is a permanent facility. So that's not the entire list. The bill complements and expands on the efforts already taken at the state level, as the packet explains, across jurisdictions that have had taken 3 major approaches to addressing period poverty: mandating free menstrual products available in schools, ensuring incarcerated individuals are provided with access, and exempting products from sales taxes or the term luxury product tax. Maryland has advanced these policies statewide, but Bill 4223 will expand access and equity for all individuals who need access to these products. One of the bill's supporters is the Maryland Academy of Family Physicians. Their executive director, Becky Wimmer, provided this statement. The Maryland Academy of Family Physicians supports providing free access to female hygiene products in public restrooms. Public restrooms should provide patrons with access to free menstrual hygiene products as they would for other hygiene products such as toilet paper. Menstrual female hygiene products are a medical necessity. Access to these products is a gender equality issue with public health implications, end quote. And as I mentioned, the Maryland Academy of Family Physicians, the Montgomery County Black Collective, the DC Diaper Bank, the National Office of Period have all endorsed this bill, and we're working on others. Ann Arbor, Michigan became in 2021 the first jurisdiction to require all public restrooms to have these products. Washington, D.C. and Brookline, Massachusetts have required it in public buildings, and as I mentioned, there are many efforts around the country to do similar types of laws. So thank you, Mr. President. I have spoken to both the regulations, so I won't need to do that later. Would ask colleagues to consider this and look forward to the public hearing. Thank you.